My experience. We'll talk today about the global fascial approach. We have actually some objectives to achieve, so the presentation is kind of condensed a little bit, so if you don't mind, we'll keep questions to the end of the presentation. Why our doctors need to know about the global fascial approach? Number one, many patients can be helped by this approach, especially chronic problem patients, because this approach is not limited to the orthopedic patients. Example of case study, we have at Paulson, we have several patients with headache, neck pain combination. When we treat the neck pain, we get from the headache. Frozen shoulder with chronic pulmonary dysfunction, chronic shoulder pain, rotator cuff, frozen shoulder. This is the relation we're going to discover today, how this relates to each other, how chronic pulmonary dysfunction relates to frozen shoulder, for example. Sacroiliac pain or pelvic torsion in relation to leg length discrepancy or plantar fasciitis. Normally when somebody have a plantar fascia, usually keep treating the foot. With the global manual approach or global fascia approach, we have more understanding that the plantar fasciitis could be as a result of something else and the pelvis maybe. Many post-total knee, total hip patients with poor rehabilitation outcome. So if your patient is not progressing well with traditional therapy, so that's the patient we are interested in. Chronic low back pain patients related or neck pain with negative radiological findings. So many of our patients normally go through several investigative radiology or MRIs or anything, but actually there's no solid significance in the MRI where the doctor say, okay, this patient needs surgery, or this is clear disc prolapse or dysplasia. Chronic edema not related to common pathology like cardiac or renal edema. The actual goal of the presentation to explore fascial relationship and its effects influence on the human physiology. It sounds crazy linking the fascia to the human physiology. It's sound a little bit big, but actually we'll figure out this in a moment. Fascial relationship to the central nervous system, peripheral nervous system, cranial nerves, and other structure. There's a huge relationship between fascia and posture. Beyond it, actually, that's another story. But there is a proven research stating that there is a relationship between musculoskeletal disorder and visceral problem. That's through the fascial system too. Fascial relationship to the lymphatic system is very close. Global approach and philosophy. The philosophy of the global approach to treat the patient as a whole, in totality, not the symptom. Many symptoms is just as result of something else. So the pain usually is the final expression of the problem. In order to understand the concept, we have to go back to some principle, how we see patient, how we think when we see patient. The first basic concept, structural function relationship or interdependence. For example, if somebody have a muscle spasm, that will affect the venous return, will affect the lymphatic system, which may affect the functionality of the muscle. Second concept, rule of artery is absolute. It doesn't mean here artery means the arterial blood, any fluid system. So the tissue with that balanced fluid system is not going to work well. For example, if somebody have a compression or restriction of vessels, will result in stasis and thus and eventually lead to tissue damage. Or, in other words, it may maintain what we call the disease state. Same thing like if somebody have pain in the like post-traumatic chest pain, like car accident, their vital capacity will be affected because of it, because they can't breathe well. So that eventually may lead to some adhesions on the pleural system or pleural sac, where it may affect their immunity to fight pneumonia, for example. We may see those patients later with recurrent pneumonia because they don't have the ability to expand their chest and pumping the lymphatic system in that area. Third concept is the body is a functional unit. The body unit united by its fascia, believe it or not. The whole system and the whole body, visceral, like all the organ, muscles, bone, everything, vessels connected with one system called fascia system. The fourth concept is the inherent ability of the body to heal itself. That's in case of the body is functional or mobile. According to Still, Dr. Andrew Tiller Still, the body, properly nourished, has a natural store of substance to fight disease, repair, and maintain normal health. So our goal always to restore mobility between systems to restore the patient's inherent ability to heal themselves. So that's in addition to the pharmacological health. Okay. In order to understand the fascial concept or the global concept, we need to define some word like somatic. What does mean as somatic dysfunction? Somatic dysfunction is the impaired or altered function of related component of the soma, the body framework, skeletal, arthrodile, myofascial structures, and related vascular, lymphatic, and neural elements. So if you have any alteration of those systems or our relation between them, that will affect or will create what's called somatic dysfunction. And TART, this is diagnostic criteria most of physicians use for what's called somatic dysfunction. If the patient have a tenderness, asymmetry, resistance or restriction, and texture changes on that around system or surrounding area. There is many ways therapy can help, but it's more like, you see some of that is like myofascial release, more like local. The difference between the traditional therapy and the global manual approach is we look at the patient as a whole and relationship. To explain the fascial connectivity or continuity in the body, we have to give a good example. Most of us treat spine. Easy to treat spine with that body or spinal, like just a spine. But it's quite hard to treat a spine with a lot of attachment, like muscular attachment, fascia attachment. We have several models of fascia like this one and this one. So the fascia have many functions. Part of that function is to compartmentalize the muscles and organs. There's another model of fascia. It gives you an example. If you pull from here, it may affect somewhere else. There is a common example. For example, the old style appendectomy normally develops some kind of fascial pull in the left shoulder after some years. That's because of the pull may result from the adhesion happen from the scar. How you can treat the spine with a lot of relationships in front and behind the spine and around the spine. Some of those relationships are vascular and very important. We have a lot of relationship to the neural system, a lot of components, a lot of layers. This is a simple example of what happened if this is an inferior view of the diaphragm and some of the opening. Can you imagine if by the way, the diaphragm considered part of the fascial system in the body. Imagine if the diaphragm becomes tight. it will affect definitely the aorta, the esophagus, the vena cava. It can affect everything. How we can treat the spine without considering the diaphragmatic attachment to the spine itself, because it's not equal. How we can treat the spine with a lot of structures, organs in front and around, like the pericardium. So we have to look at the patient as a whole and with strong relationship between the fascial system and other organs. Autonomic nervous system is a very important part of treating patients globally. So, one body, one unit, connected by fascia. So, the fascial system, how does the fascia work in our body? It's exactly like the suspension bridges. What is the difference between the suspension bridge and the regular bridge, or standard one? The suspension bridges enforces what's called the integrity model, where the more you put load, the more that load becomes distributed, and you may convert that energy to something else. So if you put any load here, or any of this point here, it distributes the weight, and that increases the durability of the structure. Same thing the fascia. This is, in order to understand fascia, you need to have the skills to discover or palpate fascia. This is the gentleman called Dr. Braille, the one who invented the method of the cards, like reading method for blind people. All of you can see very well, but if I handed you that cards, probably you cannot read it because you're not trained to do it. So very important thing, fascial system is one piece and need somebody skilled to discover it or diagnose it. There is common diagnostic criteria for fascial disorder. That's including the trigger point, tender points. It usually responds to stress. Mostly it's undefined pain, goes everywhere in the body. It moves all the time, does not respond to non-steroidals. Total view, you have to see the patient as a one piece. So the fascia is a sheet or band of fibrous tissue, connective tissue, which perform a number of functions, including enveloping, separating, binding together muscles, organs, and other soft structure of the body, providing structure, support, and protection. That's the definition of fascia. Many people work on fascia a long time. Like the history of fascia is really like far. Ancient Greek, Egyptian, Chinese has mentioned, like documented some fascial treatment, but in the recent 100 years, like last couple of 100 years, we have strong documentation from Andrew Taylor Still, Travell and Simmons, Robert Ward, Anthony Sheila, Judith O'Connell, and many others came after that. So in order to understand fascia, we need to go a little bit to the anatomy. In reality, the fascia is one piece, but for educational purpose, we divide it to 3 layers. Superficial fascia, which is directly under the skin. Deep fascia, which technically, the fascia connects, like the deep fascia connects the muscles, connect to the bone, and connect pretty much to everything, and have a relationship to the dura, the pleura, the peritoneum, the pelvic fascia. So this is a deep fascia. So most of our fascia in the body is deep fascia. The third kind of fascia is called subserosal fascia. This is a relationship in the visceral. Like this is a visceral fascia, which is very gentle, like light. Like most of the time, it's viscous, like oil. We'll come to that in a moment. So fascia have a lot of functions. Most important function to us is it's a second supporting system of the body after the bone. So this is like sound weird a little bit. How come we ignoring the muscles, for example? In reality, when the muscle is relaxed, it's no longer support. So the muscle, in order to be supported to the body, has to be in action. But this is not the case. But the one in action all the time is the fascial system. So the fascia is the second supporting system of the body after the bone. If you look at that nice picture, this is a diagram showing, this is like the skin, and this is some of the superficial fascia. And there's a lot of fascia even in between the fiber. Imagine if the fascial system becomes compressed or dysfunction, it's going to affect the fluid transferring, or may affect the lymphatic or venous or arterial flow. Of course, fascia have a different functions. So, to summarize the functions, structural framework of the body, transportation of fluid and dissolving substance, protection of delicate organs, huge deal in the viscera, how the fascia function. Support surrounding and connect other tissues, storage of energy in the form of lipids, defend the body against microorganisms. Well, there is many models of fascia release, many therapists and physicians use in their office. And it falls under the same category, but it's not what I'm talking about exactly, because what I'm talking about treating the whole body, not a specific area. Some models like cold culture strain, facilitated positional release, fascia unwinding, balanced ligamentous release, functional direct or indirect fascia release, cranial globe approach, visceral manipulation by very specialized doctors. Well, so our goal of my fascia release is to restore functional balance to all integrative tissue in the musculoskeletal system and improve the lymphatic flow by removing the fascia structure. This is sound nice if it is true, and that's what I'm going to prove to you in the next 5 minutes. Well, indication. The fascial release is very gentle process, very gentle manipulation applied directly to the tissue, even can be done for a hospital patient. The only disadvantage, the only contraindication for the fascial release is either open wound, broken bone, uncooperative patient, unresponsive patient, severe pain, fever. Well, in order to diagnose a good fascial pattern, we need to understand how our body reacts to the gravity. The musculoskeletal system is in most individuals is asymmetric, and it has a tendency to rotate in a certain direction. A physician called Gordon Zink in the, I think, 1940s, did a nice research. I think he employed about 2,000 people, individuals, where he started evaluating their what's called fascial pattern. He found that there is rotations happen at certain junction. Those junction are the occipital-atlantic joint, the junction, cervico-thoracic junction, thoracolumbar junction, lumbosacral junction. So this is the area we can say most accidents happen at the intersection. This is the intersection usually where the body rotates around. He found like 80% of the population of the healthy people have what's called left, right, left, right. So on the OA, rotated to the left, cervicothoracic rotated to the right, thoracolumbar left, lumbosacral right. And 20% of the population, healthy population, is actually going the opposite way, going right, left, right, left. And that's how it looks. So if you get, in this case, both models, like 80% or 20%, we consider it, so we call them compensated patterns. So their body is able to balance in gravity and compensate well, so that's why they are balanced. So he found on the side of the research that there is what's called uncompensated pattern people, like some patient or some individuals, I should say, they are not related to the common compensatory pattern. This is like left, 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 or right, left, left, right. In this case, we call them uncompensated. And he found those people, or those individuals, they are not healthy. So he linked that the healthy, in order to, the body has to, they should be healthy, they should have some kind of compensatory pattern, either this way or that way. 80% or 20% of the population. If the patient becomes like having that kind of pattern, they are not compensated. So that's the junction, 80%, 20%. Well, as any patient, like any patient, we have to go through the evaluation process. We see take the history of the patient, especially surgeries, falls, any best history of fall, like especially falls on the stairs, pregnancy, all that kind of stuff, how many pregnancies they have and so forth. An inspection, observation, and this is the good important part where we start to realize the mechanical, biomechanical alignment of the body. Then we start palpating the patient, then we do the traditional, the rest of the evaluation process. This is some picture of the fascia. This is a superficial fascia. We just remove the skin. Same thing here. You see that looks like very similar suspension system. This is a fascia and a muscle like they stretched from each other, so that's fascia in between. This is the greater momentum. This is the stomach, and that's part of the liver, and this is the greater momentum. And if that momentum concern also fascia, it becomes like have adhesions or dysfunction, it create also problems. Surgeons do know that a lot, like better than anybody. Here is the very important picture, whereas this is like, this is the pelvic fascia and the abdominal fascia here. This is a superior view of the pelvis. This is the pelvic ring, sacrum here. This is all the white stuff here is fascia. In reality, we have names for the fascia. It depends on the location. We have fascia lata, pelvic fascia, endothoracic fascia, cervical fascia. We have 3 layers of the cervical fascia. But in reality, it's all one piece, connected to each other. But we call it different names based on the location. Another view for the diaphragm inferior view. Here is a very important one. This is a diagram showing the large intestine attachment to the anterior abdominal wall. The only part is loose in the transverse colon. The rest of the ascending colon and descending colon, and actually they have kinks here where it attached to the splenic flexure and hepatic flexure here. All these parts attached to the anterior abdominal wall through the Toll's fascia. So this is another fascia. If it's in trouble, it creates a problem. Or vice versa, if the person have severe constipation, they're going to create a lot of load in the fascia, where at the end of the day, loads on the spine. That when we see sometimes patient with chronic back pain and related to constipation or post-hysterectomy, because what happened, everything